Hello everyone, welcome back to 和氏璧 TSM channel. Today, I'd like to introduce a special TSM diagnosis method to you. It is the pulse diagnosis, 脉诊. Pulse conditions are comprehensive manifestations of pulsation felt by the fingers. In fact, there are so many arteries can be used as the area of pulse diagnosis. But the most important and frequently used one is the 寸口 area. Some foreigners have the experience of being diagnosed by TSM doctors and were so amazed by the accurate results got through pulse diagnosis. So in this video, I will uncover the principles of it and help you better understand the pulse diagnosis. The 寸口 area is overlapped with 太渊 point, 太渊穴, which is called the great convergence of meridians, 脉会太渊, because qi of the 12 regular meridians gathered here. In addition, the 寸口 area is located on the palm side of the wrist, so it's ideal for pulse diagnosis because of its thin skin and exposure of pulsation. The 寸口 area is further divided into 寸, 关, 尺 positions. Just as shown in the picture, the medial side of the styloid process is 关, the carpal end of 关 is 寸, and the cubital end of 关 is 尺. There are 3 positions on each hand and a total 6 positions on both hands. The relationships between 6 positions and 脏腑 organs were first recorded in the 内经, in the classic. The 素问脉要经微论, chapter 17 of the basic questions, records the lateral side of 寸 on the left hand is diagnosed for the conditions of the heart, whereas the medial side is for 膻中, located between the 2 nipples. The lateral side of 寸 on the right hand is diagnosed for the conditions of the lung, whereas the medial side is for the chest. The lateral side of 关 on the left hand is diagnosed for conditions of the liver, whereas the medial side is for diaphragm. The lateral side of 关 on the right hand is diagnosed for the conditions of the stomach, whereas the medial side is for the spleen. The lateral side of 尺 on the left hand is diagnosed for conditions of the kidney, whereas the medial side is for the abdomen. The lateral side of 尺 on the right hand is diagnosed for the conditions of the kidney, whereas the medial side is for the abdomen. Then I want to introduce the concrete methods of pulse diagnosis. First of all, let's talk about the location. The physician first locates the 关 position with the middle finger, then the 寸 and 尺 positions with the index and ring fingers. Since children have a shorter 寸口 area, the physician can use the thumb or index finger to cover all 3 positions, which is called 一指定三关 in Chinese. For the next part, I'd like to show you the finger placement. The 3 fingers are slightly flexed, presenting the shape of an arc. The fingertips are kept on the same horizontal level, and the pulse is felt with the palm side of the fingers. The space between the fingers depends upon the height and arm length of the patient. If the patient is tall and has long arms, it is desirable to separate the fingers accordingly. If the patient is short and has short arms, the 3 fingers are placed more closely. Furthermore, let's talk about the palpation technique: touching, pressing, and searching. This refers to exert different finger forces and move the fingers to feel and identify pulse conditions. Touching, also known as light or superficial pulse diagnosis, means to gently contact the skin. Pressing, also known as heavy or deep pulse diagnosis, means to exert stronger finger power to reach the bones. Moderate pressing, also known as medium pulse diagnosis, means to exert moderate finger power to reach the muscles. Searching means to gradually increase finger power and search the most palpable pulsation around the 3 pulse diagnosis positions. At last, I want to stress on the cautionary notes of pulse diagnosis. The first one is timing. According to the Neijing Inner Classic, early morning is the optimum time for pulse diagnosis, because qi and blood at this time are not disturbed by food or physical activities. However, it's unlikely to feel the patient's pulse before breakfast in a clinical setting, so it's essential to make a quiet environment for the patient. Before pulse diagnosis, it's necessary to ask the patient to rest for a while to allow for regular breathing. It takes at least 1 minute for pulse diagnosis on one hand, and approximately 3 minutes for both hands. The second one is position. The patient should take a sitting or supine lying position, with arms placed at the same level of the heart, raised, extended, palms upward, and fingers slightly curved. It's also necessary to place the patient's dorsum of the wrist on a small cushion. The third one is breathing. The physician needs to regulate his or her breathing and uses his or her breathing cycle, inhalation and exhalation to count the pulse rate of patient. It's also important for physician to be fully concentrated on pulse diagnosis. The 素问脉要精微论, Chapter 17 of the Basic Questions states, only with a concentrated mind can the physician obtain the actual pulse conditions. Okay, that's the end of this section. We will introduce the element of pulse diagnosis and the concrete examples in the next video. Thank you for watching.